Okay, think about this scenario. You've got medications at home, maybe uh, something for sleep, or perhaps anxiety meds.
Yeah, pretty common stuff.
Right. Now, picture your curious dog or maybe your cat wandering around. What happens if they, mistake that pill for a treat?
It's a legitimate worry. Definitely something pet owners think about.
It really is. So today on the deep dive, we're going to get into exactly that. We're looking at what the science says when pets, specifically dogs and cats, ingest things like benzodiazepines or other common sleep aids.
Exactly. We'll be digging into how these drugs affect them. We're mainly focusing on two groups. First, benzodiazepines, think alprazolam, clonazepam, diazepam, that kind of thing.
Xanax, Klonopin, Valium, familiar names.
Right. And the second group are the imidazopyridines, which includes drugs like azopicolone, Zaleplon, and zolpidem.
Lunesta, Sonata, Ambien. Got it.
So our goal, our sort of mission today, is to really understand the effects these common meds have on dogs and cats.
Yeah, how do they work inside their bodies? What should you actually watch out for? And, what are the typical outcomes? Because there can be some, well, surprising reactions.
Oh, definitely surprising. We want to make sure everyone's informed.
Okay, let's start unpacking it then. How do these drugs actually work? What's happening chemically?
Well, at their core, both types, benzos and imidazopyridines, they mess with the brain's communication system. Specifically, they interact with something called the GABA receptor.
GABA. I've heard of that. Gamma aminobutyric acid?
That's the one. Think of GABA as like the brain's natural brake pedal. It tells nerve cells to calm down, slow their firing.
Okay, so it's a calming neurotransmitter.
Exactly. And these drugs, they basically make that brake pedal work better. They enhance the effect of the GABA that's already there.
So it's like turning down the volume on nerve excitement in the brain, making things generally quieter, calmer.
Precisely. A really good analogy. They boost the brain's own volume down mechanism.
Yeah.
Now, here's where it gets really interesting and where the differences start to matter. While both drug classes work on this GABA system, they don't hit it in exactly the same way. They have slightly different targets within that receptor complex.
Different targets?
Yeah.
How so? Tell me more.
Well, the imidazopyridines, the Ambien, Lunesta types, they tend to be more selective. They focus more specifically on the parts of the GABA receptor that are primarily linked to sedation.
So they're kind of more targeted as sleep aids then.
Pretty much. Whereas benzodiazepines, they're, let's say, less picky. They have a broader action, interacting with more subtypes of that GABA receptor.
And that wider action means?
It means they don't just cause sedation. They also have those well-known anti-anxiety effects, muscle relaxant effects, and even anti-seizure properties. This broader versus narrower action. That's key to understanding why pets might react differently.
Okay, that makes sense. And I think this leads directly into something that really jumped out at me from the research, these paradoxical reactions. It sounds, well, paradoxical.
It really is. Because instead of the expected effect, drowsiness, calmness, some pets actually become agitated,
Yeah.
restless, even hyperactive.
Wait, really? Hyperactive. You give a sedative and they start bouncing off the walls.
It can definitely seem that way. It's a known phenomenon, though perhaps not widely known by pet owners.
That's wild. So is this more common with one type of drug than the other?
Yeah, it seems to be reported more frequently with the imidazopyridines, the zolpidem, Zaleplon group, especially in dogs at higher doses.
Higher doses? Like how high?
Well, the study suggests that for zolpidem, you might see this agitation in dogs at doses above roughly 0.6 milligrams per kilogram of their body weight. For Zaleplon, it's even lower, maybe above 0.11 milligrams per kilogram.
Wow. Okay, so even a dose that might seem small for a human could potentially trigger this hyperactivity in a dog.
Yeah.
That's, definitely unexpected.
It is. And it's not just dogs. Cats can have paradoxical reactions too. With zolpidem, it's been seen in cats at doses around 0.34 milligrams per kilogram or higher. For Zaleplon, it's above 1.25 kilograms.
So cats might react at different dose levels than dogs.
Exactly.
Yeah.
And interestingly, even benzodiazepines aren't completely off the hook here. While maybe less common for the hyperactivity, excitement, irritability, or just, weird behavior has definitely been reported in both dogs and cats after ingesting benzos too.
So the takeaway is, it's not just about which class of drug, but the specific medication and the dose are really critical factors.
Absolutely critical.
Okay, so let's say the worst happens, the pet swallows the pill. What's the timeline? What happens next inside their body?
Well, generally, both these types of drugs get absorbed into the bloodstream pretty quickly from the stomach,
Yeah.
often within about 30 minutes or so.
Ah, fast, so you could see effects starting quite soon.
You could, yes,
Yeah.
relatively soon after ingestion.
And how long do these effects, whether sedation or that paradoxical excitement, tend to last?
That can vary quite a bit. It really depends on the specific drug. Some last longer than others. It also depends on the dose they got into and
Yeah.
just the individual pet's metabolism.
Sure, makes sense.
But generally, the effects can persist for several hours, and in some cases, maybe even up to a day or two, especially with longer-acting formulations or larger overdoses.
A couple of days. Wow.
Yeah. Now, it is important to mention, and this is somewhat reassuring, that these drug classes generally have a pretty wide margin of safety when it comes to lethality from a single ingestion.
Meaning it takes a lot to cause a fatal overdose.
Exactly. True lethal overdoses from just one of these pills accidentally eaten are actually quite rare. For benzodiazepines, for example, the estimated minimal lethal dose is something like 1,000 times the typical therapeutic dose.
Okay, that is reassuring. But obviously it doesn't mean we shouldn't be incredibly careful about storage. A non-lethal dose can still cause serious problems.
Absolutely not. Complacency is dangerous. And there are specific, serious concerns beyond just immediate overdose effects, particularly for cats.
Oh.
If you have a cat, this is really crucial. Chronic, long-term oral use of certain benzodiazepines, specifically diazepam, Valium, and also clonazepam, Klonopin, has been linked to a risk of something called idiosyncratic hepatic failure.
Idiosyncratic hepatic failure, liver failure, right. And idiosyncratic means it's kind of a rare, unpredictable reaction in certain individuals.
Precisely. It's sudden, severe liver damage. We don't fully understand why it happens in some cats and not others on these meds long term, but it's a known devastating risk.
That sounds incredibly serious. So for any cat owner whose pet might be prescribed these medications long term, that's a critical conversation to have with the vet. Weighing risks and benefits, monitoring.
Absolutely essential.
Yeah.
Close monitoring, regular blood work, the whole deal.
Okay. Let's shift back to acute ingestion. The pet just ate the pill. What are the actual signs people should be watching for?
Right. Well, the most common signs are probably what you'd intuitively expect from drugs that enhance GABA, that calming effect. Things like lethargy, excessive sleepiness.
Just really drowsy, maybe hard to wake up.
Exactly. And also ataxia. That's the term for wobbliness. Uncoordinated walking, stumbling.
Kind of like they're drunk.
Yeah, that's a common comparison. Just general sedation, looking very out of it.
Okay, so sleepy, wobbly makes sense. But then there's the flip side.
Right. Remember those paradoxical reactions we talked about?
Mhm.
So instead of, or sometimes even mixed with, the sedation, you might see the complete opposite. Agitation, pacing, restlessness,
A
hyperactivity.
real mixed bag, potentially. Calm 1 minute, wired the next.
It can be confusing, yes. So you need to be aware of both possibilities.
Are there any other, maybe less common signs to be aware of?
Yeah, a few others. Some pets might vomit.
Yeah.
You can also see changes in body temperature. Sometimes they get cold hypothermia because they're so sedated and still.
Okay.
Or if they're having that paradoxical agitation, they might actually overheat hyperthermia from all the activity.
Right, that makes sense.
You might also see changes in heart rate, usually an increase, tachycardia, especially with the agitation. And going back to the liver issue in cats with chronic use, if liver failure develops, you might eventually see jaundice.
That yellowing of the skin, gums, whites of the eyes.
Exactly. That's a sign of serious liver compromise.
Okay, a lot to potentially watch for. So, someone walks in, sees the spilled pills, sees their pet acting weirdly. What is the absolute first, most important thing to do? Or maybe what not to do?
Right. First, remember the most common reason this happens is accidental ingestion. So prevention is key. Store all medications, human or pet, securely. Up high in closed cabinets where pets absolutely cannot get to them.
Rule number 1, secure storage. Got it.
But if you suspect your pet has gotten into one of these pills, even if you're not sure, even if they seem okay right now, the most critical step is immediate veterinary attention.
Don't wait and see.
Absolutely. Do not wait. Call your vet or an emergency animal hospital right away. Tell them what you think happened, what drug it was, if how much might be missing, and your pet's weight. Time can be really important.
Okay, immediate vet contact. What happens then? What kind of treatments might the vet initiate?
It really depends on the situation. How long ago it happened, what drug, how much, and importantly, what signs the pet is showing.
Makes sense.
If it was very recent, the vet might induce vomiting, maybe give activated charcoal to try and bind the drug in the stomach and prevent more absorption, but that's only useful very soon after ingestion.
Okay.
For pets showing signs, treatment is mainly supportive. If they're just mildly drowsy, maybe monitoring at home is okay, but the vet will decide that.
And for more severe cases?
More severe cases like deep sedation or significant paradoxical agitation definitely need hospitalization. They'll likely get intravenous fluids, 4V fluids, to help support their circulation and organs and help flush things through.
Right, keeping them hydrated.
Exactly. And careful monitoring of their vital signs, temperature, heart rate, breathing.
Uh-huh.
They'll manage the temperature, warming them if they're cold, cooling them if they overheat from agitation.
Is there anything specific they can give to counteract the drug's effects?
Yes, potentially.
Here.
For those really agitated, hyperactive pets, vets might use other sedatives carefully, like acipromycin or maybe cyproheptadine, to try and calm them down safely.
Okay.
And specifically for benzodiazepine overdose, there is an antidote, a reversal agent called flumazenil.
Flumazenil, does it work well?
It can reverse the sedation, yes. However, and this is a big however, flumazenil can lower the seizure threshold. It can actually cause seizures, especially if the pet also ingested something else or if they were on benzos long term.
Oh, wow. Okay, so it's not a simple fix.
Not at all. It's generally reserved for really severe, life-threatening respiratory depression, where the risk of not breathing outweighs the risk of seizures. It's used very cautiously.
That's really important context. And you mentioned vets might use other sedatives for paradoxical reactions, but what about someone at home thinking, oh, he's hyper, maybe another benzo will calm him down?
Absolutely, unequivocally, NO. Do not give other benzodiazepines to try and control a paradoxical reaction. It's unpredictable and can make things much, much worse, potentially very dangerous. Leave treatment decisions to the vet.
Crystal clear. Don't try to treat it yourself with more meds.
Okay, so assuming the pet gets the necessary vet care for an acute overdose,
Yeah.
what's the general outlook? Do they recover? Okay.
Yeah, the good news is for an acute overdose, a one-time accidental ingestion, if they get prompt and appropriate veterinary supportive care, the prognosis is generally excellent.
That's great to hear.
Most pets make a full recovery with no lasting effects. The drugs are metabolized and cleared from their system.
Phew. I laugh. But there's the but for the cats and liver failure. Right. That's the sad exception. For those rare cases of cats developing acute hepatic failure from chronic oral diazepam or clonazepam use, the prognosis there is unfortunately often poor to grave, even with intensive care. It really underscores why that's such a serious concern with long-term use in cats.
Definitely. So wrapping this up, the main message seems to be, well, twofold. First, these drugs can cause serious issues, even surprising ones like hyperactivity, despite a generally wide safety margin for a single overdose.
Exactly. Don't underestimate the potential effects just because lethal overdose is rare. Significant illness can still happen.
And second, prevention through secure storage is paramount. But if an accident happens, immediate vet care is crucial for that generally excellent prognosis. And be especially mindful of the specific risks with long-term benzo use in cats.
You've got it. Understanding the risks, storing meds safely, that's absolutely vital for keeping our furry family members safe and healthy.
It really makes you pause and think, doesn't it? Considering how many households have these common medications, it prompts a wider question. What other everyday items, things we see as harmless, might actually pose unexpected risks to our pets? And how can we, be more proactive, maybe do a better safety audit of our homes to create a truly pet-safe environment? Definitely some food for thought there.
Absolutely. Constant vigilance and awareness are key.